Sakshi.
Good morning, everyone. Today I'm going to present the case of viral keratitis caused by acyclovir resistant herpes simplex virus, which responded well to ganciclovir. Herpes simplex keratitis is a viral infection of the cornea, that is the clear part of the eye, caused by the herpes simplex virus. HSV keratitis often recurs, and severe or recurrent infections can lead to corneal scarring and vision impairment. How does it spread? Direct contact. It spreads through direct contact with someone who has an active infection, such as a cold sore. Then, due to reactivation, also it can spread, as many people are infected with HSV, but the virus remains dormant and it can reactivate and cause outbreaks, including eye infections, when the immunity decreases. Then my patient was a 38-year-old female resident of Kanpur, housewife by occupation, and came with the chief complaint of pain, which was progressive in nature, irritation, which was also progressive in nature, redness, which was sudden and progressive in nature, and diminution of vision, which was gradual in onset and progressive in nature, both for distance and near. She visited an ophthalmologist nearby and was prescribed tablet Acyclovir 800 mg 5 times a day, and eye ointment Acyclovir 3% 4 times a day, but it showed no improvement. No history of similar episodes in the past. She is vegetarian by diet with normal bowel and bladder pattern and normal sleep cycle. The visual acuity was 618, and which improved by pinhole with to 69 partial. Now, the epithelial lesion with terminal bulbs was seen. These are the positive findings seen over central cornea, which was visible on fluorescent staining, and there was surrounding epithelial haze, and the corneal sensations were reduced. The plan in our center, we started eye ointment 0.15% ganciclovir 5 times a day for 1 week, then eye drop tear fresh, which is a lubricant, 4 times a day for 1 week. Then resolution of symptoms was seen, mild healing of a dendritic ulcer with only a very minuscule superior central corneal involvement left, and visual acuity improved to 6.9. Then after 1 month follow up, there was further improvement. Now, what is unique in my case? Viral keratitis caused by acyclovir resistance herpes simplex virus is relatively uncommon. The virus was resistant to acyclovir but still responded well to ganciclovir, and this is a thing to be noted, as ganciclovir is typically reserved for more serious or resistance infection often in immunocompromised patients. This suggests that the virus resistance mechanism was specific to acyclovir and did not extend to ganciclovir, highlighting the effectiveness of ganciclovir in such resistant cases. Now, the mechanism of action of acyclovir was its selective activation of by viral thymidine kinase and conversion to acyclovir triphosphate, and subsequent inhibition of viral DNA replication by incorporating into the into and terminating the growing viral DNA chain. And the mechanism of ganciclovir was inhibiting viral DNA replication through the conversion of ganciclovir to its active triphosphate form and acting competitively as a competitive inhibitor of viral DNA polymerase. Clinical implication: acyclovir resistance should be considered in cases.
Yeah, wind up. So any patient who is not responding to acyclovir, that should be done. So any what was the method you used to diagnose resistance?
Sir, the patient was resistant to acyclovir, so we can give ganciclovir in such patients
No,
because
how to diagnose? Suppose somebody is not responding, whether it is due to acyclovir resistance or due to some other factor. How will you know that?
sir, when symptoms are not improving, the
So
clinical.
one is clinical C is right, what you do, but to confirm, if you want to publish, then you have to go for some cell-based studies. For keratitis, we do this micro broad dilution technique, fungus, bacteria. But virus, it is difficult because they infect the cells. So you have to go for cellular models. Thank you, thank you. That was a wonderful talk. And in fact, resistance is a common problem in seen nowadays in